neurological assessment. I'll be doing some inspection, some palpation. Are you okay with all of that today?
Yes.
Do you have any questions before we start?
No, doc.
Okay. So before we get started, I'm just going to wash my hands and I'm going to put on some gloves. Okay, Alex? Just give me 1 second. Are you having a good day?
Yes, sir.
Okay, Mr. Smith, we're going to test cranial nerve number 5. So what I'm going to do is I'm just going to put my fingers right here on your temporal. And if you can open your mouth and close your mouth, clench your teeth. Okay, good. Temporal muscles close symmetrically, no deviations are noted. Okay, we're going to go ahead and test sensory function. So what I'm just going to do is if I get you to close your eyes, and I'm going to put a sharp pin on different areas, and I want you to tell me where you feel this, okay? Where do you feel this at?
My forehead.
Where do you feel this at?
Chin.
Where do you feel this at?
Cheeks.
Which side, right or left?
Right cheeks.
Where do you feel this at?
Left cheeks.
Okay. The client is able to record the sharp objects, and there's no abnormalities or noted. Okay, Mr. Smith, we're going to go ahead and test cranial nerve number 7. Can you smile for me? Frown. Show your teeth. Puff out your cheeks. Press your lips. Raise your eyebrows. And close your eyes tightly. Very good. The client smiles, frowns, and is able to close his eyes. Movements are symmetric. There's no deviations noted. No abnormalities are noted either. So I'm going to test your motor function. If I get you to say up, and I'm using the tongue depressor to go down, and I'm assessing his soft palate. The soft palate rises bilaterally and symmetrically on rotation. There are no deviations noted, and it is symmetric. I'm going to test your gag reflex. So if I can get you to say ah one more time, and I'm going to put this down. When I put the tongue depressor down, the gag reflex is present and is positive. Okay, Mr. Smith, I'm just going to test your ability to swallow. If I can get you, I'm just going to give you this cup of water. If I can get you to drink it for me. Okay. Did you have any problems swallowing? No problems at all? Okay. The patient was able to swallow the water effectively, and noticing his voice, there was no hoarseness noted. Okay. We're going to test cranial nerve number 11, Mr. Smith. So what I'm going to do is I'm just going to put my arms right here. If I can just get you to shrug your shoulders up. Very good. Okay. The patient was able to shrug his shoulders against resistance effectively, and it was symmetric. There's no deviations noted. Right now, Mr. Smith, we're going to test your sternocleidomastoid mastoid. Okay, so what I'm going to do, if I can get you to just turn your head that way, I'm going to put my hand right here. If you can turn your head against my resistance, turn your head back. Very good. Turn your head that way. And we're just going to do the same to this side. And I'm going to test your sternocleidomastoid mastoid. So just go ahead against resistance. Very good. The patient was able to turn his head effectively with the resistance applied. There was no deviations noted. The movements were symmetric and the strength was good at a +5. We're going to test cranial nerve number 12, the hypoglossal nerve. If I can get you to stick your tongue out for me. Very good. Now what I'm going to do is I'm going to put this tongue depressor and I'm going to push it to one side, and I just want you to push it back against the resistance, okay? So I'm going to push it toward, wait, just let me push it. Very good. Very good. Push it back to, there you go. Now put your tongue toward the other side. I'm going to put the tongue depressor here, and I want you to push it against the resistance. Very good. Patient was able to push the tongue depressor against resistance. His muscle strength is equal. Bilaterally, it's at a +5 with no deviations noted. We're going to do a general muscular assessment. Okay, Mr. Smith, if I can just get you to stand up. Very good. If I can get you to put your arms to the side and just lift them up like this. Very good, lift them back down. Now against resistance, can you lift them up? More, lift them up against resistance all the way up. Very good. Now if I can get you to bring them back down, can you put your arms to the front side like this? Now lift your arms all the way up against resistance. All the way up, all the way up, all the way. Very good. You can bring your arms down. Did you have any pain doing that? No. Okay. Very good. The muscles appear to be fully developed. The patient's able to move against resistance with no deviations noted. The movements are equal bilaterally. Alright, I'm just looking over his face and looking at his facial characteristics. I see no fasciculations, no tics, no tremors are noted. The face is equal bilaterally and symmetric on both sides. There's no drooping or deviations on his eyelids. If I can just get you to stand up. Very good. I just want you to walk toward me. What I'm doing is I'm just making an assessment of his gait. His walk is symmetric on both sides. Very good. And there are no deviations noted. He has good freedom of movement. His arms swing opposite sides and they're equal bilateral. We're going to do a Romberg test. So if I can get you to stand up for me. Now, can you put your feet close together? Very good. Your arms are going to be at your side like this. If I can just get you to close your eyes for 20 seconds. And I'm just performing an assessment. Keep your eyes closed. Okay, very good. You can have a seat. The patient was able to stand erect with minimal swaying and his eyes maintained closed and he had no deviations and no swings on his arms. Okay, we're going to assess coordination. So if I can get you to keep your arms to your side like this and lift them up right here. Now we're just going to alternate our hands. Starting with that hand, we're just going to touch the tip of our nose. Go ahead. Very good. Do it with that arm. Very good. If you can repeat that with both sides. Good. Good. One more time each side. Very good. Very good. Now close your eyes and do that same thing. Alternate the hands. Good. 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 One more time each side. Good. Good. Very nice. The patient was able to touch his finger, or touch his nose with his finger. The movements were smooth, they were accurate, and he had little hesitation from the patient. We're going to assess for rapid alternating movement. So if you can just watch me, what you're going to do is you're going to take each finger and you're going to touch the thumb. And you're going to alternate each finger to the thumb. Okay, you can start out slow. Go ahead. Good. Good. Can you get faster? Very good. Can we do the same on this side? Let me assess the movements there. Start slow. Good. Show me how you get faster. Very good. The patient was able to touch his finger to the thumb and he was able to increase his speed with no problems noted. We're going to continue with a rapid movement assessment. So if I can get you to put your palms down on your thighs like this, maybe put them on your thighs right here. Now, you're just going to alternate like this toward the other side. Go ahead. Back to this side. Very good. Continue to do that. Very good. Can you get faster? Very nice. The patient was able to rapidly move his arms up and down with no problems noted, and movements were equal and bilateral on both sides. We're going to do a heel to shin test. So what I want you to do is we're going to start off with the right side. You're going to take your right heel and you're going to slide it down this shin, up and down. Very good. You can put that foot down. Can you do the same with this left foot? Just slide it up and down the shin. Very nice. You can rest. The patient was able to slide the heel to the shin effectively with no deviations. The movements were equal and bilateral on both sides. We're going to assess. Keep recording. Don't stop it. We're going to assess light touch palpitating. Keep recording. We're going to assess light touch sensations. So if I can get you to close your eyes, and I'm going to touch different parts of your body, and you're going to tell me where you feel this sensation, okay?
Right shoulder, left shoulder, right knee, left
Very good. The patient was able to assess exactly where the touch was with no difficulty at all. We're going to assess temperature sensation. So what I have here, Mr. Smith, is 1 cup of hot water and 1 cup of cold water. So what I'm going to do is I'm going to ask you to close your eyes. I'm going to touch one part of your body, and I want you to tell me where you feel it and if it's hot or cold.
Right shoulder hot. Right shoulder cold. Left shoulder hot. Left shoulder cold.
Very good. The patient was able to tell me where he was able to feel the sensations and if the sensations were hot or cold. There were no deviations noted, nor abnormalities are present. We're going to test sensitivity to position. So what I'm going to do is I'm going to ask you to close your eyes. Don't stop. Don't stop. Wait. Put your hand. Wait. Stop. Wait. Just stop. Stop. Okay. I didn't tell you what the test was. So be normal at first. Okay. Be normal. Look at me. Okay. Just be cool. Because you were doing this. You were ready for the test before I explained the test. Okay. You good? Okay. We're going to test sensitivity to position. So what I'm going to ask you to do, Mr. Smith, is just close your eyes. You're going to extend this finger, and I'm going to move it in one direction, and I want you to tell me what direction I moved it.
Up. Down.
Okay. Let me give you the other side.
Down. Up.
Very good. The patient was able to identify what position I was able to move his finger with no problems observed. Mr. Smith, we're going to test tactile discrimination and stereognosis. So what I want you to do is I want you to close your eyes and open your hand right here. Keep your eyes closed. I want you to tell me what you can feel in this hand.
Coin.
Very good. Can you tell me what you feel in this hand now?
Keys.
Very good. The patient was able to identify the objects placed in his hand with no problems observed. We're going to test graphesthesia. So we're going to close our eyes again. Close your eyes. And I want you to open this hand. I'm going to write a number on this hand, and I want you to tell me what number you observe, what number you feel, okay?
3.
Very good. Let's do the other side now. Tell me what number you feel.
6.
Very good. The patient was able to identify the numbers felt during this test. We're going to test for extinction. Now, what I'm going to do, again, we're going to close our eyes, and I'm going to touch a body part on the same side. I want you to tell me where you feel it, okay?
Shoulders.
Very good. Keep your eyes closed.
Knees.
Very good. The patient was able to identify what points I was touching with no problems observed. We're going to test for abdominal reflex. So if I can just get you to just lift up your shirt just a little bit to expose your belly. And I'm just going to touch different parts of your belly, okay? And I'm just going to observe, do a couple of quick testing, okay? Very good. Very good. Okay. The abdominal muscles were contracting, and the umbilicus deviates toward the side that was contracted. You can put your shirt down. We're going to do the Brzezinski test. So what I'm going to do is I'm just going to flex your neck. Okay. Very good. And what I was doing is I was just looking at your hip and knee movement to see if they remained relaxed. They did not contract at all. They remained relaxed, so it's the negative Brzezinski test. We're going to do a Kernig's test, Mr. Smith. So if I could just get you to lay down right here on your back. Very good. And I'm just going to take this foot like this, and I'm just going to flex your hips and your knee, and then I'm going to straighten it out. Did you feel any pain or discomfort when I did that? No? We're going to do on this side as well, taking the foot, and we're going to flex the hip and the knee, and then we're going to straighten out. Did you have any discomfort when I did that? Okay, there's a negative kerning sign. There was no discomfort noted at all with the movements.
Come in.
Hello, Betty Smith. My name is Mohammed Hamden. I will be your nurse today. How are you feeling?
Good, how are you?
I'm doing good. Thank you for asking. So we're going to perform a neurological assessment. So I'm just going to be doing some assessments And so on top of it, we're going to check for some reflexes, and we're just going to do a bunch of neurological assessments. Is that okay?
Yes.
So the first one that we're going to do is a cranial nerve 1 assessment. So we're just going to test your sense of smell. So is your nostrils clear? Okay. If I can just get you to close your eyes and occlude one nostril for me. And I'm just going to put a scent on your other nostril. Can you tell me what you smell?
Is it vanilla?
It's vanilla, you're right. Okay, can you close the other nostril? Do you smell the vanilla?
Yes.
Okay, is it equal on both sides, or are you having any problems with any of the nostrils smelling?
No, it's equal.
Now we're going to test your cranial nerve number 2 by using a Snellen's chart. Do you see that chart right in front of you?
Yeah.
What is the lowest line that you can read?
Maybe. E, D, M, B, C, F.
Good. Can you see the line below that one, or is it not clear?
It's not that clear.
Okay. Can you close the other eye for me now?
We did the other one.
What is the lowest line that you can read?
F, E, C, B, M, E.
Very good. Can you read the line below that one, or?
It's unclear. No.
Okay. And based on the Snellen's chart, you have a vision of 20/20, so you can see at 20 feet what the average person can see at 20 feet. So there's no problems with your cranial nerve number 2. Now I'm going to test a cranial nerve number 3. So what I'm just going to do is I'm just going to inspect your eyes, okay? And I'm just looking at the margins of your eyelids. And what I see is that the eyelids cover about 2 millimeters of the iris on both eyes. So cranial nerve number 3 is intact, and there's no problems with cranial nerve number 3. We're going to test cranial nerve number 5. So if I can just get you to clench your teeth, well, I'm going to palpate your temporals right here. Clench your teeth. Very good. Did you have any pain when you were doing that? No? Okay. The patient was able to clench her teeth with no problems. Now we're going to test your corneal reflex. So what I'd like you to do, if you can just look up, and whenever you look up, I'm just going to touch the corner of your eye with this cotton, and I'm just going to assess your reflex, okay? So just look up for me. Very good. The other side. Very nice. Corneal reflex is intact with no problems noted. We're going to assess your cranial nerve number 7, your facial nerve. So can you smile for me? Frown. Lift up your eyelids. Very good. Purse your lips. Very good. The cranial nerve number 7 is intact with no deviations. They're symmetric on both sides bilaterally. Now we're going to test some of your reflexes. So we're going to start off with the bicep reflex. So what I want you to do is just relax your arm like this. Very good. Bicep reflex on the right arm was intact. It was at a +2. Very good. Bicep reflex on the left arm was also intact at a +2. Now we're going to test your brachioradialis reflex. Okay, so just relax your arm. Very, very good. Brachioradialis was at a +2. Very good. Brachioradialis on the left arm was at a +2 as well. Okay. Now we're going to test your tricep reflex. So just dangle your arm, let it relax. Very nice. Very good. Tricep reflex on her right arm was at a +2. Just dangle this arm as well. Just let it relax. Dangle, relax. There you go. Very nice. Very good. Tricep reflex on her left arm was at a +2 as well. Now we're going to assess your patellar reflex. So just relax your left leg for me. Very good. Patella reflex on her left leg was at a +2. Now we're going to do her right leg. Just relax. Very good. Reflex on her right leg was at a +2 as well. Now we're going to test your Achilles reflex. So just relax your leg in this position. Very good. Reflexes were at a +2. Now we're going to go test the other side. Very good. Very good. Reflexes on her right foot were also at a +2. Now we're going to assess your plantar reflex. So again, just relax your arm, or leg, I'm sorry. Very good. Now we're going to assess the other side. Very good. Reflexes were present at a +2. Now we're going to assess your abdominal reflex. So I'm just going to, if you can lift up your shirt just a little bit to expose your belly. Very good. And what I'm going to do is I'm just going to stroke above the umbilicus, and I'm looking for contractions. Very good. Very good. The abdominal muscles did not contract, but this is not necessarily a abnormal sign.